Prynawn da pawb croeso. Good afternoon, everyone. Welcome. It's my absolute pleasure to welcome you and joining us today. So this webinar marks an important milestone for the School Health Research Network. For the first time, we're able to share national level insights into the health and well-being of primary school children aged 7 to 11 years in Wales. And I'm sure, as many of you know, until now, SHRN has been well established across secondary schools, and it's given us a powerful picture of adolescent health. But we knew there was a crucial gap, and we were missing the voices and experiences of younger children, and that's during the most formative periods of their lives. So today, we're really excited to share with you what's been achieved in expanding the network into primary schools, how it's grown, and most importantly, how it now enables us to understand children's lives, health, and well-being in a completely new way. So I'd like to now, first of all, start off with a few housekeeping before we begin. So for everyone's point of reference, please be aware that the recording for this webinar will be live and it's recorded for quality assurance. A separate recording of today's webinar, so associated resources and the PowerPoint slides, will be emailed to you within the next week. So you'll have everything, and they will also be available on our website. Please note, however, that our recording, which will be uploaded to the website, will exclude the question and answer discussion. And that's what we're going to facilitate at the end of today. As you've probably noticed, all microphones have been muted and cameras turned off. But if for some reason yours is not, please can I ask that you turn them off now? Thank you. And we have a designated 10 minutes at the end of today's session for the questions and answers. And we'll be facilitating this as part of the SHRN team. You're most welcome, and we encourage you to post your questions into the chat as we go along. And our team will bring them up on your behalf during the question and answer section as you post them in the chat. And please don't worry, if we run out of time and don't get to answer your question, please be assured that we will email a response to you. So now towards today's webinar. So we have an exciting overview of today's webinar for you. And first of all, I'd like to introduce myself. I'm Dr. Kelly Morgan. I'm the Director of the School Health Research Network. And as I mentioned, it's my absolute privilege to be with you today. And I'm joined by also our wider, fantastic, super duper team in the SHRN here on the webinar with us. So for today's webinar, we've got a series of 3 presentations. So first of all, I'm going to start us off by giving a brief background into our expansion into the primary school setting. And again, reminding us why it's important that we're both supporting primary and secondary schools across the national landscape in Wales. And then we'll hear from my colleague, Dr. Shujin Lee, who will be sharing key findings from the School Health Research Network Student Health and Wellbeing Survey in primary schools. So Shujin will be giving us a high-level overview of the key findings, some of which many of you might have heard a little bit about today in the news, that we've had some coverage, but we'll be giving you insights into different areas of health behaviours and reports. And then finally, we have an example from Cogan Primary School, which is building brighter futures using SHRN data to empower Year 6 leavers. And I'm sure you'll be joining me in congratulating Tom Lewis, who'll be presenting on what is a very inspiring piece of work that's demonstrating what we can do with the data that's collected in schools. And finally, as I said, there'll be a question and answer panel at the discussion. I'll be chairing this and I'll be supported by my colleagues on the call. So please do post your questions as we go along, post any thoughts. We welcome all discussions. And yeah, we're very excited to begin the webinar and share our presentations with you today. So we're going to move on and begin. Before we hear the key findings from the report, I'd like to start by briefly highlighting why SHRN was expanded to primary schools, how it's developed, and what the network looks like today. To understand the growth of the network, it helps to first remind ourselves why expanding SHRN into primary schools was so important. Primary school is a pivotal stage in children's lives, both socially, emotionally, and cognitively, and it's also recognised as one of the 5 key transitions in childhood when we consider the ages between 7 to 11 years. By engaging children at this age, we're now able to understand health and well-being needs much earlier than ever before. It gives us the chance to identify emerging issues sooner rather than waiting until adolescence. And what makes this work especially significant is that it builds on the strong foundation of our national network of secondary schools. That infrastructure, trust, and partnership mean we could expand in a coordinated and scalable way. So for the first time, we now have national level data directly from primary age children. And this creates a powerful evidence base that can guide school practice, local planning, and national policy. How has this been achieved? Over the last 4 years, we've moved from a small pilot to a national network of primary schools. And this has been a collaborative effort involving colleagues in the Decipher Research Centre, SHRN, Public Health Wales, schools across Wales, wider partners, and made possible through funding from Welsh Government. We followed a phased and systematic approach, with each stage building on what we'd learned previously. And by doing this gradually, we were able to strengthen relationships and refine our processes as the network grew. Our network of primary schools has grown significantly over the past 4 years, moving from a small pilot to national participation. In total, 510 primary schools took part in the 2024 survey, and this represents 42% of all state-maintained primary schools in Wales, and importantly, with representation across all 22 local authorities. This level of participation reflects how committed schools are to understanding and supporting their learners' well-being, and how much value is placed on having meaningful evidence to do that well. From the initial pilot to national rollout, learner participation also increased dramatically with an 18-fold rise. Over 50,000 learners aged 7 to 11 years took part in 2024, but these numbers aren't just about scale. They're about what becomes possible because of this level of engagement. For the first time, we have a national picture of health and well-being among primary age children in Wales. This means children's own voices can be amplified, not just in individual schools, but in local authority decisions and national policy discussions. This data enables schools, Public Health Wales, local authorities and Welsh Government to make more informed, evidence-based decisions and to target support where it's needed most. And ultimately, it helps all of us work together to create environments where children in Wales can thrive. So that brings us to the next part of today, what children have actually told us. And with that, I'll hand over to my colleague, Dr. Shujin Lee, who will take us through the headline findings from the 2024 National Report.
Thank you, Kelly, for that great introduction to SHRN in primary schools. Now, I'm very honored to share with you the key findings from the Student Health and Well-being Survey. I will walk you through the findings based on several key areas, including students' mental health and well-being, their feelings of school connectedness and transition to secondary school, their use of digital devices and social media, and finally, their daily health behaviors, such as eating, physical activity, and sleeping. Please note that we haven't formally tested the difference statistically, so this is simply a descriptive overview of key findings. Let's start with learners' mental health, which is measured by me and my feeling questionnaire. This is a brief 16-item school-based measure of child mental health, covering two broad domains: emotional difficulties and behavior difficulties. The first chart shows the emotional difficulty score of this questionnaire, where a higher score reflects greater emotional challenges, such as feeling worried, sad, upset, nervous, or afraid. Overall, the average score across the full sample was 7.47, indicating a moderate level of emotional difficulties. There was little difference by age or year group, but we did see clear differences by gender and family affluence. Girls reported higher emotional difficulties than boys, and learners who identify as neither a boy nor a girl reported the highest level of emotional difficulties. We also found a clear socioeconomic gradient. Learners from less affluent families had higher average emotional difficulty scores. Notably, around 30% of learners reported elevated or clinically significant emotional difficulties, meaning scores of 10 or higher out of 20. The next chart looks at behavior difficulties, where higher scores mean students are more likely to get angry, lose their temper, or find it hard to concentrate. Similar to emotional difficulties, there was no clear pattern by age, but boys had a higher average behavior difficulty score than girls. Again, we see a socio-economic pattern. Learners from low affluent families had a higher behavior difficulty score than those from more affluent families. Overall, 17% of learners met the threshold for elevated or clinically significant behavior difficulties. Next, let's look at how students feel about their connection to school. Overall, 79% of learners said they like school at least a bit, and 43% said they like school a lot. However, the proportion who like school a lot decreased with age. Girls were more likely than other genders to report liking school a lot, and students from low affluence family were less likely to do so compared to those from medium or high affluence backgrounds. When asked about their feelings toward teachers and school staff, most Year 5 and Year 6 learners agree or strongly agree that teachers care about them as a person, accept them as they are, can be trusted, and that there are adults at school they can confide in. Similarly, when it comes to peer relationship, most students from Year 5 and Year 6 agree or strongly agree that children enjoy being together. Most children are kind and helpful, and other children accept them as they are. Students also felt they had a voice in school, with most agreeing or strongly agreeing that their ideas are taken seriously. They can help plan school activities, and they have opportunities to contribute to school projects. Behind these positive connections, some pupils still reported experience of being bullied or of bullying others. About 80% of learners reported having bullied others, and 51% reported having been bullied in the past couple of months. There was no clear age trend, but Year 4 students were more likely to report both bullying perpetration and victimization. Boys were more likely to have bullied others, whereas girls were slightly more likely to have been bullied. Learners identifying as neither a boy nor a girl were the most likely to report both bullying others and being bullied. And again, students from less affluent families reported higher rates of bullying others. Finally, let's look at how students in Year 6 are feeling about the transition to secondary school. Overall, 45% of students said they were quite a bit or very much worried about the transition, while 65% said they were looking forward to it quite a bit or very much. We found some interesting patterns here. Girls and gender minority students were more likely to feel worried. Boys were more likely to look forward to the transition. And students from lower affluence family tended to be more worried, while those from high affluence family were more likely to look forward to it. In the survey, we also asked around digital devices ownership and social media use among primary school students. The data showed that around half of learners reported owning a smartphone. 39% said they owned a computer or laptop, and 61% owned a tablet. For both smartphones and computers, ownership increased steadily as learners moved from Year 3 to Year 6. When we look at gender differences, fewer girls reported owning a computer or laptop, while fewer boys reported owning a tablet. There was also clear evidence of a social gradient. Learners from more affluent families were more likely to own digital devices compared with those from less affluent backgrounds. In terms of how learners use these devices, most reported using them a few times a week or every day, mainly for entertainment. Things like watching videos, playing computer games, or watching TV or films. Interestingly, as learners get older, digital devices are used increasingly for social connection. For example, the proportion of learners who use the digital devices to speak with friends rose from 29% in Year 3 to 72% in Year 6. When we focus specifically on social media use, we found that 34% of learners use the social media sites or apps a few times a week or every day. There is a very clear age pattern here. 20% of Year 3 learners reported regular use, compared to 51% of Year 6 learners. We also see a social gradient in social media use. Learners from low affluent family were more likely to use social media regularly than those from more affluent backgrounds. Now, let's take a look at pupils' daily health behaviors. Starting with healthy eating, we found that 48% of learners reported eating fruit, and 37% reported eating vegetable at least once a day. Boys were less likely than other genders to eat fruits and vegetables daily, and again, we observed a social gradient. Learners from more affluent families were more likely to eat fruits and vegetables every day compared to those from less affluent families. When it comes to physical activity, around half of learners said they exercise at least 5 times a week. Year 3 learners were less likely than older year groups to report this level of activity. Girls were also less likely to exercise 5 or more times a week compared to boys and other genders. And once again, learners from more affluent families were more likely to be physically active 5 or more times a week. Finally, let's talk about sleep. Nearly 7 in 10 learners reported having problems sleeping either sometimes or always. Interestingly, this pattern remained consistent across school years, with no strong age-related differences. Learners who identify as neither a boy nor a girl were more likely to report sleep problems compared to both boys and girls. In addition to the findings we are sharing today, our questionnaire also covered other topics around children's mental health and well-being, family and school life, use of digital devices, nutrition, physical activity, and other general health issues. You can find more details in our national report, available through this link. These are the key findings from the SHRN Student Health and Wellbeing Survey 2024. We sincerely appreciate the valuable contributions from all the schools and the students who took part. Thanks for listening.
Thank you so much, Shujin, for that incredibly helpful overview and snapshot of the findings. I appreciate for many of you, other than the snippets perhaps in the media today, that's the first time that you'll be hearing what the picture of health and well-being presents for young people ages 7 to 11 across Wales. So please note the report will be shared with you all in the chat bar at the end of the webinar, and it will also be made available on our website. But I think it really highlights Shujin's presentation how the findings present a mixed picture. So there's positives. We are hearing that many learners have good relationships with teachers and friends, as you'll see in the report, but we're also seeing these areas of concern. So the reports of emotional difficulties, the accounts of bullying, and the high levels of social media and sleep difficulties are just some for us to pinpoint. And what we know, though, is that schools are already doing a fantastic job at supporting children's well-being. We know that public health colleagues are doing a fantastic job supporting practice, and we know that there's strong policy support in Wales. So, for example, through the whole school approach to mental health and emotional well-being. But as I'm sure you'd agree, these findings do show that there's still more to do. So both in making sure that support reaches every learner and every school, but also looking at addressing wider pressures that children face outside of the classroom. And our next speaker is a great example of that work in action. So showing how Cogan Primary School is shaping its practice and making a real difference to pupils' well-being. What Cogan has done is a brilliant example of how schools can use SHRN data, not just to inform, but to inspire.
My name is Tom.
We're going to be welcoming Tom Lewis, who is the Wellbeing Lead for Cogan Primary School. And just to note that there will be an opportunity for questions and answers following this presentation, of which Tom will be able to support and answer any questions linked directly to this inspirational work. So it's over to you, Tom.
My name is Tom Lewis. I'm the Wellbeing Lead at Cogan Primary School in the Vale of Glamorgan. The aim and purpose of this presentation is to share how Cogan uses SHRN data to identify needs, take targeted action, and to ultimately improve the well-being of Year 6 learners. Cogan has worked very closely with SHRN to develop a case study that highlights its well-being journey and the impact of using SHRN data. The case study is now a valuable resource for demonstrating the school's commitment to improving learner health and well-being through evidence-based approaches. Cogan Primary School is a one-form entry school situated within the heart of the Cogan suburb of Penarth. We currently have 229 children on roll, which includes an early years unit for nursery and reception children. We also have a hearing resource base which provides support to a number of children across the Vale of Glamorgan. The base is led by a designated teacher of the deaf and a team of teaching assistants. 17% of our learners are eligible for free school meals. The health and well-being of learners is very much at the heart of everything we do in Cogan and forms part of our core values. This was identified and recognised by Estin in our most recent inspection in 2018. SHRN has been a core feature of the school's whole school approach to emotional and mental well-being. Indeed, we have been involved in the SHRN Primary School Survey on 2 occasions, the pilot in 2022-23 and most recently in 2024-25. This can be seen in our implementation tool below. What did our SHRN data tell us? Well, SHRN gave us a very clear evidence-based understanding of learners' well-being, helping to prioritise support where it was most needed. SHRN data is invaluable for understanding learner needs and guiding effective health and wellbeing strategies. It also aligns with the whole school approach to emotional mental wellbeing and curriculum for Wales. The SHRN survey revealed lower self-esteem and peer relationship scores in Year 6, which then gave us a next step on how we can implement strategies to deal with these issues. The SHRN data also highlighted that Year 6 learners were slightly below other year groups in terms of their emotional and behavioural difficulties. This can be seen on the graphs below. Our head teacher Susan Seibert stated that we are excited about the opportunities to use SHRN data even more strategically, enabling us to shape evidence-based initiatives that truly benefit our learners. From insight to action, SHRN informed support for Year 6 learners. Our SHRN findings from the pilot directly informed the school's decision to implement the Flourish project from the Proton Foundation. This was delivered by Reverend Steve Locke. A cohort from Year 6 were identified to be part of the Flourish project. Group activities focused on developing self-confidence, emotional well-being, and working as part of a team. So what did the learners that took part in the Flourish project say?
I liked Flourish because it allowed me to come out of class with my friends and do fun activities. I liked Flourish because it really helped with my confidence and got me ready for secondary school. The Flourish activities helped me with my teamwork with my friends. I like the Flourish activities because they made me more confident and they were fun.
A baseline and follow-up questionnaire with the children from the Flourish project showed that there was an improvement in all areas with regards to self-confidence and well-being. So what has changed? SHRN-driven impact on learners on a wider context. Our Year 6 teacher, Mr. Daniel Bennett, stated that the problem-solving aspect of each activity has enabled the children to collaborate as a team and also work more independently. This has empowered them and boosted their confidence when tackling unfamiliar tasks and working with other children within the class. Other improvements have been academic achievement, improved attendance, and improved learner engagement in class. SHRN is now an embedded part of how we plan, reflect, and grow, ensuring that well-being remains sustainable and learner-focused. We maintain a close working and supportive relationship with our Welsh network of health and wellbeing promoting schools coordinator. This collaborative relationship will support the use of SHRN data in improving the transition from Year 6 to 7. The graphics below serve to illustrate the importance that is placed on SHRN within the context of our wellbeing agenda and school improvement and evaluation processes. And finally, this is a link to the case study that I have been referring to, which provides a more detailed explanation of our approach to how we use SHRN in Cogan Primary School. Thank you for listening.